Do you have to replace breast implants?
Well, regarding breast implants, I tell my patient all the time, they're not good for life, right? So when we look at the old study, they used to say 10 years you have a 10% risk of rupture, and then you add 1% per year. So that means that 10 years, you have a 10% chance that your implant might be ruptured. But this was from the previous generation of implants. Now, the new generation, we're estimating that it's a lot lower than that. And that's why for us, it's super important to make sure that we see you on a yearly basis. Because every time we put an implant in you, we want to make sure that you continue enjoying the result and make sure that the results are long lasting. So we want to evaluate you, make sure there's no capsular contracture, make sure the breast is still having a proper shape and there's no ptosis, and also we want your safety in that point. So. Then a lot of time people are like, how would I know if my implants is ruptured or not? Well, the good thing is there's ways from a radiologic standpoint that we could assess that, and one of them is magnetic resonance, MRI. So we could get an MRI and it would determine if there is a rupture implants, and then it would have to be changed. We've had a few instances where a patient come to us and then say, doc, I just feel like this implant doesn't feel like the same, and then we get an MRI and it was ruptured. But I would say that it's a lot less likely, especially with the new generation gummy bear implants, where you're able to cut the implants and they stay in place and they're not liquid. So that a lot less risk of rupture with those implants.